2004, over 138,000 people were diagnosed with Hodgkin's, and they are still allowed to tell about it. So this obviously shows that treatments have advanced, which causes the survival rate of the people who have Hodgkin's disease to increase. Doctors diagnose Hodgkin's disease with a biopsy. This is basically removing a piece of tissue from your body and looking at it under the tissue, looking at that tissue under a microscope for examination. The treatment often includes radiation or chemotherapy. Hodgkin's disease is curable, and there is a greater success in early diagnosis. Many different factors come into play when deciding on the amount and kind of treatment that are given to each patient. Some factors include the kind of Hodgkin's disease you have, your age, your health, your medical history, and results of blood and other lab tests that are given. Treatment options also take into account if the disease has spread. Many different tests may be used to help figure out, where in your body the disease might have spread, and some of these tests include x-rays, the CT. The CT is like an x-ray, but it just uses a CT scanner to take many pictures of the body instead of one. MRI tests may be done as well, but these are rarely used with Hodgkin's disease patients because only if the doctor is concerned about the spread of the brain or spinal cord, they will perform these tests on the patients. There are 4 different stages of Hodgkin's disease, and these are based on how much cancer is in the patient's body. Early detection is definitely the key with diagnosis and to begin treatments. The cause of Hodgkin's is unknown. The risk factors for Hodgkin's disease include an increased risk of Hodgkin's disease in people who have had mono. These risks are very small, and the disease is found slightly more in males than females, and is found mostly in the United States, Northern Europe, and Canada. The family history plays a little factor when considering the risks. Family association only accounts for around 5% of the cases, and it's obviously not significant enough for people to be too concerned about that. Brothers and sisters of young people with the disease have a higher risk for Hodgkin's disease than those who do not have siblings with the disease. For identical twins, the risk is very high, but again, overall, only 5% of the cases has been found to have family association. There's a virus that has been found to be a factor around 40 to 50% of Hodgkin's disease patients, and it's the EBV. It's the Epstein-Barr virus, and this could be a key factor in determining the actual cause of Hodgkin's disease. The implications for the families may include financial burdens, with hospital costs, and this can be really emotionally and physically draining while their family member is going through all the treatments for Hodgkin's disease. The resources for the families, there's plenty of sites out there, including curehodgkins.com. It has different types of information about how you can give money, to find a cure for Hodgkin's, and has a list of different people's stories and what they've been through. And some other resources include the American Cancer Society Patient Resource Center, the Lymphoma Information Network, the Lymphoma Research Foundation of America, the Leukemia and Lymphoma Society of America, and NCI, What You Need to Know About Hodgkin's Disease.
I'm Shannon Lang, and I am reporting on Down syndrome. Before taking a look at the diagnosis of Down syndrome, the first and most important thing that I would like you to know is that your baby or your child is a child first. While doing research on Down syndrome, the most important piece of information was to remember that your child has unique characteristics that make your child who they are. And these characteristics do not come from Down syndrome. They come from the person that your child is. Another thing to remember is that a child with Down syndrome will flourish in a loving family. There are several distinguishing characteristics of Down syndrome, and children with Down syndrome could have all or some of these characteristics. Congestion in mouth breathing, which will make the tongue protrude out. Shallow breathing will also make it difficult to get oxygen to the brain, causing a mental delay, low muscle tone, and slow development in mobility, such as learning to crawl and walk. Because of congestion, fluid can build in the ear, making it very difficult to hear and making learning language extremely difficult. There are distinctive malformations of the head, which could include a small head, upward slanting of the eyes, small nose, and a flat facial profile. Also small ears, a narrow roof of the mouth, vertical skin folds covering the inner corners of the eyes, and extra skin on the back of the neck. Abnormal extremities may be present, including short arms and legs and short fingers. The prevalence of Down syndrome has nothing to do with race, nationality, religion, or socioeconomic status. In the U.S., approximately 1 in every 800 to 1,000 children have Down syndrome. Between 250,000 and 300,000 families are touched by Down syndrome. 80% of babies are born with Down syndrome to mothers under the age of 35. Children with Down syndrome have a chromosomal disorder, and all or a portion of chromosome 21 is replicated 3 times rather than twice. Because of the distinguishing characteristics, once born, it is diagnosed simply. There is genetic testing that can be done to determine if the child will have Down syndrome while the mother is still pregnant. Mosaicism, trisomy 21, and translocation Down syndrome. Down syndrome is a chromosome variation, so the actual cause is unknown. However, some risk factors have been determined. The chance of having Down syndrome increases with the mother's age, and if the father is over 50, it also increases. For a baby with trisomy 21, the chance of reoccurrence in a sibling is 1%. But for a child with translocation Down syndrome and a parent carrier, the chances increase. Genetic counseling can be helpful once the child is born or after a prenatal diagnosis. Like with any diagnosis, the initial shock of having a child with a disability can cause conflict in the family. Also, medical bills can be extensive. However, early intervention is provided to facilitate learning development. And the earlier the intervention, the better. Children with Down syndrome benefit from loving homes, education, appropriate medical care, and positive public attitudes. Some resources for families are to locate a genetic counselor near you. Go to the National Society of Genetic Counseling at www.nsgc.org. Also, there's a lot of parent information at www.ndscenter.org. The NDSC offers a free publication for parents who have received a prenatal diagnosis, and the National Down Syndrome Society can help hook you up within your community at www.ndss.org.